Thank you all for having us. My name is Robert Ratner. I work for the County of Santa Cruz along with Kern and many other folks. And we're here to talk about prescribing home. We're both actually working in the healthcare field, directly and indirectly. And we wanted to share how we both got to this place in our lives where we felt like, we need to be able to have a prescription pad so that people have a home to have wellness and health. And there were three major themes that I think we're going to talk about together. We're going to kind of go back and forth, try to do, I don't know if you all are public radio listeners, but this is a storytelling session. We're going to learn from each other in front of you all. But three things that we were interested in sharing are, how did we end up getting involved with healthcare and seeing housing as critical to health and well-being? Like, what was our personal journey? What are some stories we've heard along the way about how home really impacted people's well-being, whether it's ourselves or others? And third, what is the healthcare system getting wrong around thinking about housing and health in general? So I'm going to start by asking Karen a question. Karen, can you share for the group how you ended up getting into healthcare work and seeing housing as part of healthcare?
Yeah, thanks, Robert. I am a person with lived experience of homelessness. Between roughly like 86 and 95, I lived on the streets of Oakland and Berkeley, and also was struggling with my own mental health and substance use. And I got there through a series of, unfortunate events. That's another long story for another day. But I ended up, toward the end in 95, I went to jail for the whateverth time. But I found out I was pregnant in jail. And I had, the pregnancy test and I don't know if anybody's been in jail in here, but there's a whole intake process, and you get seen by a nurse, and the nurses, well, I'm sure there are nice nurses working in jail and prison system, but this one was not, and just had some really harsh words for me, like, oh, you people, people out there, living on the streets and doing what you're doing and trying to bring children into the world in the wrong way and whatever. That was very politely put. She said it much more, Anyway, I got back to my bunk. I got through all that. Oh, first I went to the holding cell. And in the holding cell, there were 5 other women. Never seen them before in my life. And I was sort of stunned when she said, "You're pregnant." I was like, how's that possible? And I shared, with the women in the cell that I was pregnant. And immediately, all of them just wrapped around me and, oh my God, that's amazing, that's so cool, this is wonderful, blah, 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 blah. And I was thinking to myself, like, okay, like, I'm homeless, I'm using, I've got, a lot of depression, I'm struggling, whatever, and I'm gonna bring a baby into this world. It's like, maybe not the best idea. But by the time I got back to my bunk, it was a Deputy Kim Barkas, still works for Alameda County. And she said, "Kern, what are you doing pregnant? That's not like you, you're too smart for this." And that sort of stuck with me. So by the time I was done with jail that term, I had made the decision that I was going to figure out how to change my life. And on some level, I think I was looking for some sort of an excuse or some sort of external motivation to pull me out of where I was. So, divine intervention, whatever you want to call it. So I got out. They put me on methadone when I was in jail. And so I was able to get to the clinic. I went back to homelessness. I was homeless in Berkeley, but I hung out sort of near the methadone clinic so that I could get to dose every day. And I went in and out of this sort of using, not using, struggling with depression, whatever. Anyway, ended up getting onto benefits. I went to Human Services at 401 Broadway. And I had an experience there where I was waiting with my packet, which is like this thick of applications that took me forever to fill out, and whatever, all that process that the system makes it so difficult for you to navigate. And I pulled my number and I sat down a couple seats away from an older gentleman who had a walker. Anyway, they called the numbers, and they called a number, that person didn't show up, and then they called my number. And I noticed as I was getting up that this gentleman was also trying to get up to the counter and realized that his number was a number before mine. So I got to the counter and I told the woman, hey, this person I think was the person before me. And she was really irritated And anyway, I sat back down, and they had, their communication was very difficult. He had a hard time communicating his needs to her, and she was just, annoyed mostly. And I just thought to myself, like, we can do better. Like, we have to do better, And that stuck with me. So by the time I ended up finally 5 months out of jail and on the streets, pregnant, I finally got into residential treatment and went through that, got out of that, was homeless again for a period of time until I finally got into a transitional program and ended up being the house manager there. And then, the rest is history. I finally got an apartment from there and kind of moved on with my life. I answered an ad in the Oakland Tribune for a admin tech at a youth residential treatment facility. And I thought, oh, this is cool. I can do this. And I did that. And I ended up staying there for about 10 years and worked my way up to a sort of manager position. And at that point, I had gone back to school, finished my bachelor's, finished my master's. But before I got into my master's, I had to make a decision about whether I wanted to go into social work or counseling, or whether I thought I could do something different from the systems perspective. And all the experiences I had trying to navigate systems kind of came back to me, and I thought, that's what I'm going to do. I'm going to work within the system to change the world. And now here I am in the system. I like to think I am changing the world a little bit at the time, although it wasn't like the big, exciting change I thought I would be able to bring. And how about you, Robert? How did you get here?
Yeah, I have a slightly different story from Karen, but I'm so glad she's in the system with me and trying to make it better for all of us. My story is I grew up in a suburban lifestyle with a pretty stable home and family, and then I went to college in LA. And all of a sudden, what I sensed as home, earlier we heard about belonging and what that feels like. I remember the first time I was in the dorm room, I was like, wait, I just lost something. I lost the sense of home. So I had housing, but I had lost home. So that began a 10-year journey for me of feeling like I didn't have home in my life as a student. I think I lived in 15 different places, starting undergrad to graduate school. And during that time, I got, looking back, I think I got really curious about the benefits of having housing but not feeling like I had a home. And I was in school, I'm dating myself, when homelessness became a social construct in our society. 1987 is when the federal government passed legislation to create programs specifically for homeless individuals. So that the idea that homelessness is a thing and we need whole institutions and systems to focus on this new thing didn't really start until the late 80s. And I was a student at that time, and there was a lot of activism. So I ended up talking to folks. I volunteered at soup kitchens. I worked in a clinic, the Venice Family Clinic. I spent the night in shelters just to do overnight shifts and meet with people. And I remember one individual I met who slept on the campus. I got to know him. His name was Jason. And we would talk a lot. And he said something that really stuck with me. He said, how are you feeling sleeping on campus all the time? Wouldn't you like a place to live? And I could help you find a place. And he says, I've tried that before, but what I've found here is home, and everything that people have offered me before, it doesn't feel that sense of belonging for me. So the distinction between home and housing became really clear to me then. I left out part of this story. When I started school, I wanted to be the orthopedic surgeon for the Portland Trail Blazers. And then over time, as I got to understand the healthcare system more, I discovered that the healthcare system was really a sick care system. It was about treating people when they're sick, but I didn't know that when I signed up to go through the pre-med path and become a physician. And over time, as I worked in that environment, I was like, wait, I'm just helping people when they're sick, but I'm not really helping them to have a home. I'll remember I worked at San Francisco General during my first medical clerkship, and one of my first patients, and this was in the fairly early stages of the HIV epidemic, he was an African-American gentleman who'd been homeless for 5 years, didn't have family and friends, and he was the last patient I was talking to that night. And I sat down with him and learned about his story. And at the end of the conversation, he said, Robert, I know you're offering me all this stuff, but no one wants me, I've got nowhere to go. I don't feel like I have a reason to live and a place to call home. I ended up making a medical student error and prescribed a particular medication that one shouldn't have prescribed for someone in his current situation. And the next day, I found out he had died. It struck with me just the error and having to process that, but what really struck me is that he had lost the will to live. He had lost a sense of hope and connection. And that really dramatically, there was a lot of buildup to that point, but it became really clear to me that working in the sick care environment was not my personal calling. Karen found her path that led her to this point, and mine has kind of brought me to, we need to have a healthcare system that's about health and helping people get to the fundamental things they need for wellness, not just treating people when they're sick. So I'm privileged to work here in Santa Cruz on that issue, and we call ourselves Housing for Health because having a stable place to be where you can feel a sense of home is critical to well-being. Karen, do you want to speak a little bit to some of the things? Thank you. And your experience, personal or professional, how do health and housing really interact with each other? And where do we kind of get it wrong as healthcare people?
I mean, I think that homelessness puts you at risk for poor health, and poor health puts you at risk for homelessness, right? So when you're on the street or, when you're unhoused, you are living in your survival brain, your amygdala. It's really all about just trying to stay safe, get your basic needs met, which you may or may not be able to do. And then you're in this sort of heightened sense of hypervigilance, your body's dumping cortisol, whatever. I mean, you're stuck in that place, and you really can't access health in a real meaningful way without being home, somewhere where you're home and you can lay your head down and feel safe. You can sleep with both eyes closed. You feel like you have your ability to, keep your stuff with you, or track your appointments, or your whatever time it is or whatever day it is. Like, all of that is really critical to managing your health. And without that, you end up, just like I said, stuck in that place. And so I think for us here, really trying to figure out how to link, like Robert and I work closely together on a couple of projects, trying to build housing and healthcare together. So really trying to figure out, for the folks that I'm serving who are experiencing homelessness, how do I get that quick pathway into the housing system? And the same thing for Robert. He's got people in his housing system that have mental illness or substance use, but he can't figure out how to get them into treatment. And so Kismet maybe brought us together, but we're taking it and running with it, and trying to really rebuild the system from the inside. Yeah. Anything else you want to add?
Yeah, I think for me is the healthcare system is getting more and more interested in housing, and there's a couple things that I wanted to share that I think we're getting wrong in thinking about housing. There's this term called housing first that became all the rage because there's some research that instead of requiring people to go through all this treatment first, actually just what Karen was saying, people need a place to land and then the treatment becomes more effective. Well, what we've ended up doing is housing only in a lot of cases. Yeah. So we've forgotten to pair, and that's why I love working with Karen. The home and the health have to come together to really help all of us. I think another thing that the healthcare system and our society struggles with is we're so into sickness and individualism and sick care. We spend the most of any nation in the globe per capita on healthcare, but we're 47th in life expectancy. Yeah. So one concern I have about, and Karen and I are healthcare people getting into the housing business, but I think really for health to be successful for all of us, we need the housing sector to step up and not have the healthcare people figuring out how to do housing. So that Karen and I have both learned a lot about housing and building, but we're not the right people. We weren't trained in that. So we've got to figure out partners and how to expand housing, create more homes for folks. Last thing I'll say is I think the distinction between housing and home, there's a group of folks who live through homelessness, who struggle with mental health and substance use issues, who are part of a national panel trying to come up with recommendations for all of us and what's essential for recovery for mental health and substance use challenges. They said 4 things. Number 1, home, the housing, the stable place to be. 2, good health care that helps you to stay in your home. 3, we often forget this in healthcare, community. Many people that we serve in our programs, we help them move into their own apartment, but they're very alone and isolated. So how do we help bring people into community? And that's why I love what we're talking about tonight, belonging. And then the 4th thing is purpose. All of us to be well need something to do to motivate us to get up every day, to have something meaningful in our lives. So hope you leave with these 4 things: home, health, community, purpose. Let's all make it happen.